Hello, I'm Dr. Kritzer. Welcome back to A Parent's Guide to the IEP. This is Unit 2, Part 1, Children with Disabilities in Schools. Well, IDEA, the major law of special education in America, identifies 13 disability categories that children might have in our schools. Those disabilities are classified into two categories: high incidence and low incidence. High incidence disabilities are the most common disabilities in our schools. One of those would be the specific learning disability, by far the major group of disabilities in our schools. Students with a specific learning disability have difficulties in reading, math, and or written language, and have processing problems and need to be identified as having achieved lower than their ability, lower than they should be achieving academically. Another high incidence disability in our schools are children with emotional disturbance. This is a very serious category. These children are at risk. These children might be a danger to themselves and or others and require the therapy and academic support that is quite involved for them to be successful. This is a very serious category. Another catch-all category, a high incidence category in special education, is what's called other health impaired. This is where children with attention deficits are often included, hyperactivity, as well as children who have illnesses that cause them to miss a lot of school. Another high incidence disability very common in our schools are children with communication disorders, children who have difficulty articulating sounds such as the R and the TH, or children with language processing difficulties. The communication disorder specialists, the language and speech specialists in our schools were some of the first people to operate pull-out programs in our schools. And then there are children with low incidence disabilities, children who are more severely disabled. For example, autism. Autism became a category in 1990, and children with autism have serious social and behavioral as well as academic issues. Children in our schools might be visually impaired and are entitled to services that will level the playing field for them. Other children might be hearing impaired and are also entitled to services that will allow them to access academics in schools. Some children have intellectual disabilities which used to be called mental retardation. These children have IQs below 70, as well as adaptive behavior deficits. A typical child with an intellectual disability, perhaps in kindergarten, does not toilet themselves yet. That would be an adaptive behavior deficit. Some children who are ages 3 to 8 have something going on with them, some issues, but we really can't decide. We really don't know yet. Those children fit into the category called developmental delay. And after age 8, we need to define what their disability is. Some children are born with issues, severe issues visually and hearing. There are children born deaf, blind, and it's not enough to teach these children using specialists for the visually impaired and specialists for the hearing impaired, because the interaction between these two disabilities is so extreme that requires further specialization. Some children have physical disabilities that impact their academic performance, and they are entitled to services. Children in wheelchairs. Some children need standing apparatus. And then final category are children with traumatic brain injury. Children who have suffered severe shock due to falls or perhaps electric shock. And they are entitled to special services. And this has been a review of the various disabilities that children might have in schools. I will be back with you again for Unit 2, Part 2.